The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show we'll be talking about Medicare, particularly how it addresses mental health issues. We have over 230,000 Montanans on Medicare, and we talk about health issues, but many times we don't talk about mental health issues. There's probably some assistance out there for you if you know about it. We'll talk about that and so much more. Stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Good morning and welcome to Aging Horizons. I'm your host, Brian Lamore, and we're brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. Of course, we have a wonderful guest, as we always do. Returning again is Kimmy Everman. You're the social media and outreach person for DPHHS.
I am.
Welcome to your show.
Thank
I love saying that.
Thank you.
Well, you know, in the opening I mentioned we're talking about Medicare and we're talking about mental health. And there are benefits under Medicare for seniors, but you know, when we talk about seniors, are their mental health issues a little bit different than the rest of the population?
Well, I certainly think so. As a layperson, I certainly think so. You know, today, just as an example, not today, yesterday, a number of us, because I've talked to some folks, got in our email inbox a study that says the new mental health epidemic is loneliness.
Yes.
And it just, you know, first of all, it broke my heart.
Yeah.
And then secondly, I thought, okay, that fits our older adult population perfectly because so many of them have lost a spouse and have no, you know, support in that way. You know, many folks, like my mother and dad, were married 60 years. And when my father passed, I don't think my mom knew what to do because it's like losing your right arm, kind of.
Yes.
And so I think also, you know, as we age, I know I've noticed it in myself where I have less, I get snappy or impatient, and I never used to be that way. And so there's things that happen in your life, I think, that really definitely are mental health related issues. And I think another thing that is, you know, concerning to me is that I think a lot of folks know Medicare covers your doctor's appointment and your lab work and all that kind of stuff, but it also covers mental health assistance. And we've talked about many things on this show, and I like to always say we need to fight the stigma that you're crazy if you do need some assistance, because I did a little research, and just a few of the things that Medicare will cover in this realm: depression, anxiety, PTSD, and also more significant or more serious issues, schizophrenia, bipolar issues, things that can really, really mess up your life if you don't know that you even have it.
Right, yeah, you might not notice it.
Right.
Well, I know that they were talking about, I talked with our suicide person, and he said, you go to the dentist twice a year, your eyes once a year, your physician once a year. What do you do for your mental health? And that is a big issue, and it can really help out. And that doesn't mean that you have mental health issues, but how can you do things better? Like we're talking about loneliness. How could they help you to address that? I know our area agencies on aging, we have senior centers, and that was designed that you'd come together, you meet other people, and it helps you to socialize.
And you know what, I think we want to just put the number up on the screen for that. Thanks for mentioning the area agencies, because for one, the area agency, and for two, we want to make sure that they know how to get a hold of a SHIP counselor, because we haven't mentioned them yet. And when you are talking Medicare, you are talking SHIP counselors are the best resources and contacts that you can possibly find. They're in our area agencies on aging, so they're right in our communities. And they will help if because again, the mental health coverage, people may not be really aware of what's even covered. And so, it would be nice to have that connection with a SHIP counselor who can maybe give you some guidance. I mean, and as we have said many times, SHIP counselors do not decide for you. They don't put you in, on a road to a certain person or anything like that. They just give you the facts.
Just facts. Well, I wonder how we initiate or we become aware of mental health issues. We have once a year Medicare checkup. You fill out an inventory, I guess, and they're always concerned about suicide. But I imagine an individual can initiate that. Maybe a loved one can initiate it, or maybe your physician. But how does one start and address that?
Well, I think you've mentioned all the ways, Brian. I think that, again, the stigma attached to it can be so serious for some folks. And, it may be that wall that they can't get through. So if they have a family member or a friend or a coworker who's willing to just support them and be there, because that's what they can do. You can be a kind, non-judgmental friend who is just there to support that person.
And many times that individual notices a change. We don't. And as I understand, when we get sick and ill, that it affects our mental health.
Oh, absolutely.
And we may not notice that. So it needs to be addressed. Well, but I think what's good for our viewers is to know that there is a system out there. We talk about Medicare. We say, okay, what's my health? What's my vision, hearing, health, teeth? But we talk about the mental health too. And how do we stabilize that? Or how do we maybe get rid of loneliness, which has just been identified as a major issue amongst all of our population? How do we interact with other individuals and help them out? Maybe by just being a friend. But Medicare is there. It will help pay those bills if you feel, or if your loved ones feel, that you should do it. Now, I've been accused of going to a counselor recreationally, and because they really do help. They help lay out guidelines and objectives to meet your personal interests that you might not be aware of. But this is a big topic, and we have more in the show. Stay tuned.
Can you say ombudsman?
Bidsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare and the importance of Medicare benefits of mental health. You know, if you have some illness, there's a possibility you could have some mental health issues or just need a little help getting over it. Or, you know, you need to maybe plan out your life a little bit further in the future. Well, Medicare is there to help you. We join us with Kimmy Everman. And Kimmy, let's kind of start at the top. Medicare.
Yeah.
You know, we need to pay for this.
Right.
We have Medicare. We may have an Advantage plan. What's the difference and how do they work together?
Well, okay, so first of all, let's just very quickly go over some of the areas that might be covered for a person. And, you know, I had talked in last segment about depression, anxiety. You may have PTSD, which is post-traumatic stress disorder. That's become a very widely, unfortunately, diagnosed area for people, and it's just it's a trauma-based thing that, you know, we're sorry to see that folks have it, but you can get some help. And the other thing that people might want to know about is that you can also look into addiction treatment for things like opioid abuse or alcoholism. And, you know, we know that as we age, you know I get a new med just about every year. And you shouldn't drink and take medication.
Yes.
You just shouldn't. And I think you know, a lot of us don't realize how really dangerous that is. So this is a way that you can get that treated if you feel that you need that assistance. And you know, Part B of Medicare. So, and we're talking original Medicare here, or traditional, I guess. Part B is going to cover the outpatient mental health assistance or care, and that might include individual therapy, group therapy. There might be an outpatient piece of it that's substance abuse that you're working on. Art therapy, I said that, I guess. An annual depression screening. Another thing is the telemedicine.
Yeah, that's big.
You know, I know that's not part of the payment piece here, but I want to remind folks that Medicare has really stepped up to the plate and made that possible and made that something that they'll pay for. And I guess I wanted to just say that from a personal perspective, that's how I do my meetings with my therapist. And believe me, I love it. I just love it, especially when it's snowy and cold cold and horrible outside.
Or now hot.
Yeah,
really
yeah,
hot.
or now hot. Yeah, exactly. And so, and also, just it's very convenient. So
Yes.
that's and here's the other thing, Brian, that, we talked a lot about stigma, and that's another reason I love the telemedicine, because you're in your own house.
Mm-hmm.
You're comfortable, you're sitting wherever you have your computer, and you probably have the door shut, nobody's listening to you.
Yeah.
I have found it to be absolutely wonderful in terms of feeling safe and secure,
Yeah.
and able to say everything I need to say
Yeah.
to that person.
Because you have to be honest.
Yes,
Yeah.
indeed. So I think that's a really great piece of this puzzle. Another thing about the payment, though, that we want to point out is be sure that when you are choosing a therapist or someone to guide you, that you ask if they accept assignment.
Yeah.
Tell them that you're on Medicare and ask, do you accept assignment?
Right.
And Brian, what that means is that person, that provider, is going to take whatever the payment from Medicare is,
Yes.
and they're not going to bill you the balance. It's
Right.
called balance billing. It's kind of a big, we don't want to do that.
Yeah.
And so be sure you ask that. And then you asked about the difference between traditional and Advantage plans. You know what? Everyone's going to be different, and you're going to want to, like with a Medicare Advantage, you're going to want to talk to those folks and see how they handle it and what they pay for. That's a great time to call a SHIP counselor as well, and just get a better feel for what you're working with, so that you know what questions to ask. And then the only other thing I wanted to say is that also, if you're on a Part D plan already and you're on medications for your mental health issues, just be sure that your Part D covers it. And if not, if you're having issues accessing the medication you need, talk to your doctor and maybe talk to a SHIP counselor.
That's right.
Yeah.
I hear you say talk a lot, and talk to your physician, talk to a therapist, talk to your insurance care, Medicare, talk to your Advantage plan, and listen to how we're talking. So we do have some solutions here that can help out.
Exactly.
And it's a SHIP counselor.
Yeah. And I think it's really, you know what, we got to battle that epidemic of loneliness. And if it's just talking to somebody about your Medicare, there's nothing wrong with that.
Yeah.
Connection, human connection is human connection.
Yeah.
And we really want to encourage that.
And the counselor will address your issues that you're talking to them, and they'll give you some solutions and probably follow up on those steps, which is a solution-based outcomes, I guess we'll say.
Well, and it makes you feel empowered to get something actually done. And that can go a long way to really helping a person's frame of mind.
Frame of mind. And it's important to note that these individuals, it's kind of like a frog boiling slowly in water. You don't realize what's happening. By talking to a professional, they can define that, and they can help set you on a path for solution or assistance. Many times it's not that difficult. It's just that we don't have the wherewithal to see what is happening. So we encourage people to talk to those people. And we'll continue talking in our next segment about programs that are here to help you, so stay tuned.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Like many areas in Montana, Helena is nearly surrounded by forest and is at risk of a devastating urban fire. Wind-blown embers from wildfires have ravaged communities like Denton, Montana, and Boulder, Colorado. Now is the time to prepare your home for wildland fire, no matter where you live. Be aware and prepare. Make you and your community a safer place. Visit firesafemt.org, paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare and the mental health programs that are out there to assist you. There are a lot of them, and you need to be aware of them, but you need to be aware that maybe you would like to seek some counseling. Rejoin us is Kimmy Everman, and Kimmy, you know, there is a possibility that you would be an inpatient person. How is that different, and how does Medicare cover that?
Well, first of all, it's covered under Part A, not Part B, and there's going to be, and that's usually something that's either a mental health issue or substance abuse issue, or maybe both, where you need to be inpatient. You know, with other inpatient areas in Medicare, you get so many days, and you know it. So my suggestion with that is just always to either, if you feel you can look it up yourself, fine. You can talk to your doctor about it because they're going to know, or you can call a SHIP counselor and they'll help you figure it out. But I think that it's really important for folks to know that there is a number of days with a with a perimeter around it, and you only get so many, and you don't want to be shocked with a big bill at the end.
Okay, and a loved one can help
exactly
by calling either the provider or the health insurance people.
Right.
But now, you know, when we're talking about you're an inpatient, that's kind of a crisis time, and we do have 800 numbers for both suicide and crisis intervention. What are they, and why are they important, and how do they help out?
Well, and this one's even easier than 1-800. This is just 988, and it's called the Suicide and Crisis Line. And you know, and we always have 911. So if you cannot remember 988, just call 911. That's perfect. You can get assistance that way. But you know, I think it's so important, Brian. We need people to reach out, and these crisis lines are staffed by just wonderful, compassionate people who really know their stuff and are really willing to step up to the plate with you and to help you through whatever it is you're going through, and then to get you down the line so that you have someplace else where you can get more assistance. So, 988.
Okay, well, you know, Kimmy, we hear a lot in the news that there's apparently a lot of crises going on. And you can call it, or a loved one can call it to get help.
Right.
But let's say, what is a crisis? I know what suicide is, but what's a crisis?
Well, you know, I think, okay, from my personal standpoint, and as a layperson, I think crisis is those times when you just get so overwhelmed that you, with life, that you don't feel you have options to get out of that, or maybe maybe a big giant bill came and you and you were shocked, or I mean, I just think if it feels like a crisis to you, then it's a crisis. I would never judge what a person thinks is difficult, but I will say I think the bottom line is you're overwhelmed.
And I think the 988 number gives you options that you may not be considering. So, Also, let's kind of change the subject a little bit to Medicaid unwinding.
Yeah.
That's a big topic we've been seeing in the news, and things may have been changing, but what is Medicaid unwinding?
Well, and we don't want to get real complicated. It doesn't have to be that.
Yeah.
But, during the COVID public health emergency, all the time that the Office of Public Assistance spent in the past redetermining folks on Medicare and Medicaid and the eligibility for their Medicaid. All over the country, public assistance offices stopped working on that particular thing. Well, we've got to get back to business now.
Yeah.
And we want to let folks know that they're starting to look at those redeterminations again about your eligibility. It doesn't mean you're getting kicked off, but they're looking to see who's eligible, who isn't. Because, the COVID situation put some folks onto Medicaid that maybe wouldn't be eligible anymore.
Right.
Under other rules. And so one thing, you want to watch your mail and make sure that if the renewal form comes, you get it, you fill it out, and you get it back to the Office of Assistance to make sure that the Office of Assistance is aware of your address. Be sure that they have your correct address. And just, if you don't want, if it's too much to fill out that form, call a SHIP counselor.
Yeah. And we want to quickly cover also that we have helping programs for individuals on Medicare. And of course our SHIP counselors can help you out with those because a number of them, and if you're eligible for one, or ineligible for one, you might be eligible for others. So
right. And just very quickly, we have low income subsidy, and that helps with your Part D. And there's levels of assistance, so even if you make a little bit more money, you might still even be eligible for another level that's within the program. We have MSP, which is the Medicare Savings Program. That helps pay that Part B premium every month. So that's putting another, I don't remember, but let's just say it's $150. That's $150 that stays in your checking account for you. To do whatever. So you definitely want to look into that. And then finally we have the Big SkyRx program, which we love to love on it because it's a homegrown program and it helps folks with the Part D premiums. And the good news about Big SkyRx is that the eligibility is not so stringent, and they don't care if you have 10 houses. You can still look to see if you're eligible, and it pays the premium every month. So up to a certain bar standard, so maybe that's $40, let's say. Again, $40 that stays in your checking account.
So talk to your SHIP counselor. The number's on the screen. And Kimmy, thank you for coming in and explaining this to us. We've been trying to squeeze a lot of information in a little bit of time here. And mental health, it's a big issue that really we're not recognizing, and we need to address this. Thank you for joining Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.